Said. They call me Abdul. I am the New Manor Public Health Initiative director of New Manor and founder of the New Manor Public Health Initiative. And this organization has been a while since we established. It was 2010, while we are under local college with a few students. The reason that we create this organization is the need of the community, because we have seen a lot of needs about the health issue. Our community is, they have a low literacy in the community, and we do not have any access to the healthcare systems. As we know, the United States healthcare system is very complicated. So we figure out if we start from the simple empowering, educating, like washing hand, it will be preventing people from disease. So a few students come together, we organized, we established this organization, and we opened office at the Lisbon Street. That was 2010, and 145 Lisbon Street. Then we applied for 501c3 to be a non-profit organization, 2014. Then we received our status. Then we have got a few grants to operate our organization. Currently, our organization expanded. We have a few programs, which our mission is more focusing on public health. As we know, the state of Maine has a lack of public health infrastructure. We do not have any public health office in the citywide. We don't have any public health organization who is working with the New Mainers people or population. So there is a lot of health disparity, systemic racism in terms of resources, sharing of power. So many things are complicated in our community. So the vision and the mission of our organization is to empower, educate, and advocate about the public health to the New Mainers population. So we start to provide Section 28 through the collaborating to the Department of Human Service, and currently we are hiring, and we hire almost 16 BHP who is working in the front with the kids who are autism, Down syndrome, and a developmental delay. We also have 5 staff, which is paid staff, including me as an executive director. We have a human resource director. We do have a financial and office manager, and a program director, and outreach and literacy director. So something I would like to emphasize here, we need a collaboration of all the ECBOs. I know there is so many things needs in our community, and so many ECBOs are doing great job in the community, but we need to be collaborated to be heard our voice. In terms of, if, for example, if I give you, there is a lot of problems in the school system, so we need organization who will be able to work with the school system. Civil engagement, we do not have any single organization who is doing the civil engagement to our community. We are here, we are not moving somewhere else, we stay in May. So we need our kids to be involved in a civil engagement. We need an organization who will be able to work with the Maine Equal Justice, MPA, Maine People Alliance. So those are the 2 organizations who is working in the ground to engage us with the civil engagement. So we need organization, who will be able to work with the school systems, how our kids will be able to engage in the civil engagement. Currently, we collaborate with the University of New England. For example, I'm just giving you example. So we are working a project called Pipeline, with navigating healthcare system, healthcare field to the New Mainers. So we work with almost like about 25 students, and we engage them or collaborate them with the University of New England, University of Massachusetts, and a local college, so they will be able to study in healthcare field. Because As we know, the health disparity is existing, is a systemic way in the United States. The only way we can reduce the health disparity is to empower our own people, which is our own youth, to encourage them to study healthcare field. We've been here for almost 15 years and we have only a few nurses and one PA. We need a doctor. We need to see a few doctors in CMMC, St. Mary's. We have pharmacists. We need teachers to teach our kids in the school. So we need, to involve in the community. That comes from ECBOs, which is ethnic-based organization. We need to involve. We need to be active. We need to work together. There is so many things that we can do together. It doesn't matter, your mission or vision. Still we are one people. We speak one language. So let's work together. So many things on the ground. We have so many things to do to empower our community. And for the mainstream organizations, we need, a clear and vision that I will be able to work with it. And we need some support from the new main organization, the mainstream organization, so they will be able to empower us, in terms of advocacy, empower us in terms of leadership. We need a training how to be a leader, like a clear leader who have a vision and achieve their goal. So I just want to conclude all my, I'm not gonna be like a long speech. This is advice for all the ECBO's leaders. Unless we work together, we cannot do things as we want. That's I'm gonna say again. Unless we work together, we cannot be able, what we want. So let's go together. Let's work together. Let's share all things together. Thank you.